I'm Pamela D Wilson, caregiving expert, advocate, and speaker. I am here for the module called Why Care Plan. Care planning is one of the most important things that you can do. I know there are many, but one of the most important things that you can do to care for an elderly parent today and years into the future. In this part, we're going to talk about some basic measures to manage chronic health diseases that you can implement on a daily and an ongoing basis to support the care of your elderly parent. As always, we're going to start with housekeeping. As you know, I use the term elderly parent or elderly parents for the person for whom you provide care. The outline for this module is in the course materials. Please print this out and the slides so that you can follow along with me. Let's talk about the objectives of Why Care Plan. At the end of Why Care Plan, you should be able to complete a list of measures to monitor daily care and chronic diseases and to avoid hospitalizations. You'll create a care plan through this process to manage individual concerns and overall care for your elderly parents. The objectives of basic measures is that you should be able to track and understand the measures that relate to managing chronic health conditions for your elderly parents. You should be able to create action steps for health concerns to avoid health from getting worse and to avoid hospitalizations. We don't want elderly parents going to the hospital if we can avoid it. The idea is to start with immediate concerns. Planning involves projects in addition to using the daily parent routine. When you create specific goals and you accomplish them, as we talked, your confidence increases. This also happens with your elderly parents. Your self-esteem increases because you commit and you complete projects. Planning for basic measures to manage chronic health conditions and to avoid hospitalizations involves participating in short, mid-range, and long-term projects. You want to think about what you want to accomplish and then work with your elderly parents to create goals for results and to gain their participation. This process in the healthcare system is a term called outcomes. You're creating outcomes. You may hear that. You may hear that in a doctor's office or in a nurse's office. What are the outcomes? What are we trying to accomplish here? This is what we mean. So, for example, an elderly parent wants to stay at home but is a fall risk. What outcomes surrounding reducing falls are beneficial? For example, you might install safety equipment, ask the doctor for a physical therapy order so that you have exercises that your elderly parent should do every day. Your parents might join a recreation center. They might go 4 times a week to exercise and participate in social activities. If nutrition is a concern for an elderly parent, you might create that meal plan we talked about. If your parent is overweight, you create a meal plan for weight loss that also includes physical activities and diet modifications. Your elderly parent has to be a part of these plans. They have to be motivated to participate if they want your participation as a caregiver. If your parent is diabetic, what daily care tasks and precautions must you and they implement? Remember, this is a 50-50 road. It's 50-50 participation. When a loved one has a debilitating illness like Alzheimer's or dementia, a different plan is needed that is addressed in a different module. The module for creating a plan for loved ones with memory loss goes into great detail about caring and planning for elderly parents and others with memory loss. Here we're talking about parents who have their memory and their ability to understand what we're asking. Let's talk about tracking basic measures. For elderly adults, the effects of physical activity, inactivity, predict the ability to remain independent and living at home. We have talked about this the entire course. Our goal is to help them stay at home as long as possible. This slide, this graphic, are a reminder of some of the information that we discussed about the fact that physical activity does prevent heart disease. type 2 diabetes, many types of cancer, prevents dementia, depression, and anxiety. Everybody can benefit from physical activity. It doesn't matter your age, your ethnicity, shape, size, any of that doesn't matter. You want to get out and be active. Because we know this, for adults, chronic disease protects health and well-being when we are older. Knowing measures supports us being proactive to manage our health. When attending medical appointments, take out your pen, ask the doctor for these measures: cholesterol, triglycerides, blood sugar, blood pressure, and weight and body mass index. Understand how these numbers relate to health and health conditions. And more importantly, talk about consequences. Until we start to talk about consequences of not taking action, few people willingly take action or understand the reason to take action. This includes our elderly parents. It includes ourselves. This is a graphic of the 10 most common chronic diseases for adults 65 and older that begin 10 to 20 to 30 years younger. They begin in your 30s. Begin by identifying which conditions your elderly parents have. Identify what conditions you might have. Talk about the consequences to help your elderly parents become motivated to improve lifestyle habits. Consider the same for yourself. For example, we know this. Heart disease can lead to clogged arteries. Managing cholesterol and triglycerides and weight are measures to manage heart disease. Talk to the doctor. Request copies of your blood work that shows these measures so that you have the numbers, so that you know the numbers. Once you start tracking this, look at past blood work, make a comparison. Are your readings or the readings of elderly parents improving or getting worse? High blood pressure can be monitored by the use of an at-home blood pressure machine. You can get these at pharmacies like Walgreens, Walmart, Target, any store. Talk to doctors and healthcare providers to identify specific preventative measures to manage cholesterol, triglycerides, weight, body mass index. Discuss the measures with your elderly parent and gain their agreement that they are going to take steps to improve this. Part of identifying these measures is learning about the health conditions so that you can be proactive in the care of elderly parents and also discover for yourself at the same time how you can manage your own health. Part of it is monitoring trends to manage changes in health. When I managed the care for my clients who had multiple health conditions, my staff, the care providers that I had in place, we tracked blood work, we tracked the measures, we created ongoing measurements to monitor any small change in health. Because the ability to notice the little things and identify changes early is very beneficial to prevent more significant health declines and to prevent having to go to the hospital for an emergency. I created lists, we had spreadsheets, we tracked weight, blood pressure, blood sugar, oxygen levels, temperature, food intake, fluid intake, how much people drank every day, daily exercise, the time they got up, the time they went to bed, the time they napped. Changes in any one of these measures, if your parent has a lot of chronic conditions, helps you be proactive to contact the physician, to ask questions, to ask for instructions. While this may seem a lot to track, and in some situations it is, I admit, but involve your elderly parents in tracking. That supports their consistent involvement and their consistent effort and attention to health. You know the old saying, what we measure gets done. All of these measures help with tracking the risks of health declines. The numbers don't lie. Rather than reviewing this process as a negative or being burdensome, create that tracking notebook or some spreadsheets that you view positively when these actions are measured consistently. Because when you look at this as an action that can support health, it can be like a scorecard, like a grade card that generates accomplishments, that is very positive, that you and your elderly parents can congratulate yourself for all of these efforts. So how do we do that? We create a tracking notebook. When elderly parents experience health concerns, the tracking notebook can help you see the trends so that you can identify things that happen before a health episode or an illness. For example, a trend could be a fever one day and a fever not the next day, or a temperature that is a sign of an infection or something like pneumonia or a urinary tract infection. Reviewing trends allows everybody to be more attentive to a drop in oxygen level, to a rise in blood sugar or blood pressure, or a change in any measure. With time and experience, you will be amazed at how you will notice these small changes in your elderly parents. You will look at them and you will know something is wrong. The presence of multiple chronic diseases makes this type of monitoring valuable when you know what numbers and readings have an effect on the health of your elderly parents. Tracking these numbers and taking that information to doctor appointments is helpful for physicians managing the health of an elderly parent. By using this process, you will receive fewer worried calls from your parents at work. You'll be able to manage the health of elderly parents by attending regular medical appointments and contacting your doctor's office to ask questions, to present situations, and to prevent concerns from advancing. When I had my care agency, we would have detailed notebooks that were 1 inch or 2 inches thick with spreadsheets that we created with tracking lists. We wanted the caregivers to make notes of what happened during the day, anything unusual. I can't tell you how valuable that is in managing the care of your elderly parents, but have them participate. Make them write down the notes like, I had a good day today, or I woke up and I didn't feel so good. I felt nauseated. I felt dizzy. You will be surprised what you learn and how this tracking notebook can improve the care and the health of your elderly parents and save you time that is unnecessary when the health of an elderly parent becomes worse because someone didn't take action. Doesn't have to be that way. Older parents don't have to be old and sick. We don't have to be old and sick. Let's talk just about summarizing this information. So depending on the health of your elderly parent, that tracking notebook to review basic measures can help manage chronic disease and avoid unexpected events. Daily tracking is beneficial for some individuals when they have chronic diseases that you are working to manage. For other people, maybe weekly or monthly tracking is sufficient if they don't have a lot of illnesses. But knowing the measures, the blood work measures of cholesterol, triglycerides, blood pressure, blood sugar, weight, and body mass, they are important at any age. They're important for you today in preventing chronic disease, in managing the chronic diseases of elderly parents. Knowing these numbers establishes that tracking point to support consistency and creating plans to care for elderly parents. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. Thank you for joining me for this webinar. In the next webinar, we are going to talk about creating a care plan, and I will share a care plan document with you that I used in my care management practice with my clients. That is an invaluable tool. I will see you again in another webinar. Stay with me.